Hi, this is Terry Kuti, founder and director of Deep Sea Foundation, where we talk about various topics related to breast cancer, breast reconstruction, and we have some wonderful guests. Today, I'm joined by a friend across the pond in the UK, and her name is Liz O'Riordan. Liz is a breast surgeon, a breast cancer survivor, and an author. Welcome to the program, Liz.
Thank you very much, Terry. It's great to be here.
We have a pretty important topic this morning.
We do. We
Yes,
do.
yes. Um, it's I don't think it's often talked about, especially Liz. You know what I've noticed? I've noticed that it's talked about a little more openly over in Europe than in
Yes.
the US. The
But
top,
even then, it's barely talked about.
oh yeah. So let's go for it. We're going to have a talk on sex this morning.
We are. We
But
are.
more importantly, we're going to have a talk about how breast cancer patients, after treatment, after any kind of surgery, whether it's breast surgery or breast reconstruction, how that affects their sex life and some tips and tricks we can do to hopefully help out because it's not an easy path. So what I
No.
want you to do, Liz, is I'd like for you to tell us your story, your personal story, real briefly first, so that viewers have an idea. You're the perfect person for me
Yeah.
to talk to about this. And then, oh my gosh, the topics that I got to talk about this morning, um, how to find the confidence that you had before your breast cancer diagnosis.
Yeah.
How will losing sensation affect sex? Also, some people ask, how did how did your husband react to having no breast or new breast? If you had
Yeah.
implants or autologous reconstruction, dryness, low libido, the list goes on and on. Let's cover it. Go.
Been there, had it all. So I don't know what it's called in the States. I was a consultant breast surgeon in the UK. I don't know if that's an attending, I'm not sure, but I was the top level surgeon and I did breast cancer reconstructive surgery. And at the age of 40, with no family history, I was diagnosed with a stage 3 mixed ductal and lobular cancer.
Mhm.
And it was big in a small breast. And I knew when I saw the ultrasound what it would mean. I had 5 months of chemotherapy to try and shrink it down, and that did shrink it away completely. But I still had an implant to mesh reconstruction because my boobs are small. And I went back to get the results, and there was actually 13 centimeters of lobular cancer left in my breast that hadn't been seen on the scans, and it had spread to my lymph node. So I went on to have a clearance in my arm and then radiotherapy to my chest wall. And I started on tamoxifen, and we call it Zoladex, the monthly injections to switch your ovaries off. And 2.5 years later, I was having an awful lot of pain in my implant because of the radiotherapy. It was very, very hard. And I had a lot of cording. I had a frozen shoulder. And I just thought I wanted to go flat. And I went to see my surgeon. And I had a nodule of scar tissue just on my chest wall. And she did an ultrasound. And it looked a bit odd. And it turned out to be a 3 centimeter local recurrence.
Mm.
So I had my implant taken away, I went flat, I had more surgery, I had more radiotherapy, and I switched to letrozole. And the side effects of all that treatment meant I couldn't operate. I couldn't lift my arm properly. So I had to retire as a surgeon, and that was in February last year.
Wow. You know, there are parallels between your treatment and mine. I had a recurrence also.
Yeah.
I I had radiotherapy or radiation, as we call it in the US, my first time. Uh, Refused chemotherapy my second time. You know, we make these hard decisions.
We do.
Liz, I mean, you, along with so many of our viewers that are going to be watching this, went through such huge bodily changes. You had to make
Yeah.
all these tough decisions. You're a married woman, whether you are a partner with a same sex marriage. I've talked to women like that. It's your sex life can become so affected. So dive into how you dealt with
I
that.
will.
Yeah.
So As a surgeon, I had no idea how much of an impact breast cancer would have on relationship sex life. I never talked about it. For
Mhm.
me, it started during chemotherapy because I lost my hair and I wanted to connect with my husband. I wanted to try being intimate, but suddenly, does he touch my bald head? And we could still feel the lump in my breast. And does he touch it? And we didn't talk about it before we got there. And it was just awkward and really weird.
Mhm.
And I felt ugly. I felt awful when I lost my hair. And my husband still found me attractive, but I didn't get it because I hated myself and I didn't want him to come near me because I didn't see it.
That
And he actually said,
self-confidence,
no, he
gaining
said
that
he felt
self-confidence.
impotent. He said he felt impotent watching me go through chemo because he couldn't help. He's also a surgeon, but it was that he still found me attractive, but I felt I looked like an alien.
Hmm.
I just didn't associate it with my body in the mirror. And when I had the surgery, I had no idea that the breast skin would be numb. It never dawned on me. And in the winter, when you come in after a run, it's freezing cold in the shower because it doesn't have blood underneath the skin and there's no sensation. And I think we say it's a breast reconstruction, but it's not. It's recreating a lump of tissue to put in your bra. It doesn't have the erogenous sensation a breast does. And my left breast was the one that worked. There's no sensation on the right. The nipple doesn't work. It does nothing for me. You may as well got rid of them both. But suddenly that part of foreplay is gone.
Hmm.
And I never looked below the mirror because I hated it. With an implant and radiotherapy, it was scarred and lumpy. And I just thought, I'm not a woman. And I don't think you know what your breasts mean to you until you've lost one or both of them. You don't get, I felt vain for wanting an implant because I wore a lot of low cut v neck tops. And I felt vain for wanting that. So I didn't have to change my wardrobe. And I didn't realize how much of an impact it would have. But along with the whole body image point of view, it was the effects of the tamoxifen and the aromatase inhibitors. And I used to tell women, you know, hot flushes at night sweats. I never mentioned vaginal dryness. And suddenly, like many, many women, I was thrown into an instant menopause. I thought I'd wet the bed. There was sweat running down the back of my legs. I thought, what the hell is going on? And I didn't talk about it because I just assumed, like many of us, I should be grateful to be alive.
I know who wants to talk about stuff like that,
I
but
know. I mean, we don't. You don't talk about sex with your partner, let alone your GP or your surgeon or your nurse. Like, how do you go and say? Plus, I worked with the people treating me, and they work with my husband, so it's very hard to bring up these things.
oh yeah, very complex for you. Yeah, that self-esteem, someone brought
Yeah,
that up, just the loss of self-esteem.
yeah,
Uh, let's talk about the vaginal dryness and some of the things that women can do
yeah.
for that.
So I think, firstly, it's not about sex. But
Mhm.
estrogen is a natural lubricant, and without it, everything can get dry. Your joints, your muscles can get dry and sore. Your vagina can get dry, and that's why a lot of women get recurrent urine infections and they get cystitis. I found it painful riding a bike. I'd get tears in my labia because everything was dry and sore. And that was something that needed treating before you even go on to sex.
Okay.
But when it came to sex and intimacy, I didn't get physically turned on. I could look at a film where everyone I know is going, oh my goodness, like Dirty Dancing. I grew up with that. I love that film. Now, nothing. It doesn't do anything physically. And my husband would look at me with that look in his eye, nothing would happen physically.
Mm.
And it was that sign that my body had stopped working. And trying to explain to my husband that I still found him incredibly attractive, but I didn't get physically turned on like I used to, and it wasn't his fault. And that was very, very hard to come to terms with.
Mhm.
And it was also realizing that you lose your libido as well when you don't have any estrogen. And I think it's worse when you're on the aromatase inhibitors and the Zoladex, you have nothing. My libido is gone. I don't want sex. I'd rather have a cup of tea and a biscuit, as we say over here in the pond. And again, that's really hard to explain to your partners because they still love you. They still find you attractive. They often still need a physical relationship. And I'm like, nah, it's very hard to rebuild things.
Yeah, yeah, it is. Who, and then, I had other women who mentioned too. I mean, we're both married women, Liz, but
Yeah.
I had women, they're single,
Yeah.
you
To
know, and
dating, what do you do? I've
yeah,
got a
what do
fake
you do?
breast. I can't get dry. It's, oh, yeah.
Yeah, and they maybe they have no nipples, you know, and they want to start dating again. Wow, that is huge to overcome. All
I
right.
know a lot of women have been on forums asking other women how they cope for tips, but what I want to talk about is the tips I've used to see if that can help you get going.
I was going to say, let's
Yeah,
dive
let's
in.
dive right in. So I think, sorry, Terry, I'm interrupting. I could talk forever.
Oh no, I want you to talk forever. You're the woman here we're interviewing, and
Okay.
I because Liz, let me grab something here real quick. One thing I want the viewers to know, I have this book on my list. And I'm not okay, Liz didn't tell me to advertise this book. I'm
I
holding it
didn't.
for a reason. In your book, I want the viewers to know, I'll have the information for this when we get done here. We'll put it on the video. I have it on my resource page too on my blog. But you have a great chapter in here on it. So you go
Yeah,
ahead,
it's
because a
all
lot of what you're going to talk about is
I will do.
in this book.
The first thing to say is lubricant should be your best friend.
Mm-hmm.
Everybody should use it, whether they've had cancer or not. It makes things more fun. It can transform your sex life. But when you can't get naturally wet, lubricant is your best friend.
Mm-hmm.
In the UK, a lot of people first reach out for something called KY jelly, which we use for rectal exams and vaginal exams. It's awful. It's full of chemicals. We have access to something called Yes in the UK, which is water-based or oil-based. It's safe for vaginal and anal sex. There are no chemicals. I've tried silicone lubricants and I didn't like them. I found they smeared everywhere and didn't stay where I wanted them to. But a natural chemical-free lubricant, get it, use it. If you're dating and your partner doesn't know, you can always pop some inside when you go to the loo when you get home before you go upstairs. It's a natural way of getting things easy. I put it inside and I put it on my partner because it just helps things slip and it stops the rubbing and the chafing. It should be your new best friend.
Yes, I have been told, and what we use is a water-based natural
Yeah,
lubricant.
yeah,
Those tend to be the best. So
yeah.
okay, onward and upward.
And now, assuming for a lot of people, penetrative sex isn't the be all and end all. And it's important to say that. Often what you want changes as you get older, and often doing everything but outer course massages, manual stimulation can help. But for some people, they need to have penetrative sex. And it may be that your partner needs it. And you as a woman may have to think, I have to put it in the diary. Because the first time you try it, it can be very, very sore and you don't know what to do and it can put your partner off. And it may be you think, right, I need to get ready to do this to help keep the relationship together. And the more you do it, the better it gets. But the problem is your vagina is a muscle. And when it's not being used, it can get tight and stiff and it doesn't stretch very easily. And if the thought of putting your little finger inside terrifies you, you're never going to have sex with a man or a woman, whatever you're using. So you need to stretch it up. And I recommend dilators. Now I have a set that start little finger size and they go all the way up to a full erection. And I got all this information from women on the internet who shared with me how they'd coped. And I take this everywhere I teach. If you can gradually stretch yourself up using lubricants in the shower on a daily basis, knowing that you can get that inside you, then you reassure yourself and your partner that sex may be possible. You can even do it with them and make it part of foreplay, but you need to do it 2 or 3 times a week to keep things stretched.
You know, it's funny. You talked about riding your bike earlier.
Yeah.
This is a loose analogy, Liz, but I mean, sex is the same way. You don't get on the bike the first time and learn, you know.
You
so
don't.
After breast cancer and after being affected by all of the treatments and surgery, again, you know, and we talk about having, we talk about getting exercise, you know, daily or 3 to 4 times a week.
Yeah.
Like your analogy of using these dilators 3 or 4 times a week to get it stretched up, to get it working again. That's a good analogy.
Exactly. And the more you stretch it, the easier it gets. But a lot of women find that they can't get the large dilator in because they're still too stiff. So what I recommend is, and this is great for anybody just starting out, is to get a small dilator and to masturbate yourself until you orgasm. When you orgasm, the vaginal wall relaxes and dilates, and it's much easier to get this in. And it
Mhm.
also reminds you that you can enjoy sex. You can have an orgasm. It can be a great way to get to sleep. You can still get a bit of pleasure out of it. And that can really, really help. But a downside of that is if you are relying on your partner to help do this with you, the pressure is on for them to help you masturbate to a climax. And if you don't climax, then you might not get the dilator and you might not have sex. And it's almost, so how can you take the pressure off? And I tell a lot of women to go upstairs and sort themselves out. So you go
Sort
upstairs
themselves
with
out, meaning self-stimulation and masturbation.
exactly.
Yeah.
So you're in the mood, you're never going to have spontaneous sex again. You tell your husband, give me half an hour and then you can come upstairs. And you go upstairs, you light the candles, you've got a good book or something that helps get you in the mood. You get your dilators, your lubricant, a vibrator, and you masturbate yourself. You self-stimulate yourself to an orgasm. So you're relaxed, you can dilate yourself, you know this has gone in. And then your partner can come up.
Mhm.
It's really awkward when you first start. It'll be really, really strange, but that is a very good way of helping get things going. The more you do it, the more into the habit you get, the easier it gets. But it is hard work.
Yeah. Yeah. Well, okay. Breast cancer is awkward. So
Yeah.
now we have to work on our sex life. It's awkward, but we have to do it.
But you
Um,
can do it.
yeah. I have a quick question because
Yeah.
you are a physician and you know this because someone asked this I'm looking at my phone here and all these questions that came through because I posted something last night. Someone asked about vaginal estrogen creams. Can you?
Yes, I was going to come to that. Yes, I will.
Yeah.
So we now know that vaginal estrogen is safe,
Mhm.
even if you have an estrogen positive cancer.
Mhm.
There was a survey published in the States by your gynecologist that said it's safe to give. A tiny, tiny amount is absorbed into the blood if you use vaginal estrogen, and that is tiny. It doesn't make any difference. Some doctors are more risk averse if you're on letrozole or anastrozole because you have no estrogen, but I still say it's safe. And I think it's a quality of life issue. If for me, having vaginal estrogen gives me less vaginal dryness, less soreness when I'm riding a bike, helps me be intimate with my husband, I would rather take that risk than
Mhm.
not have it.
Yeah,
Because we know it
I
can come back in a third of women, whether you have all the treatment or not.
yeah.
And I think it's quality of life. And if you are informed as a patient and say, I want this, I accept the risk, thank you very much. The problem is when I use Vagifem, which is a tiny, tiny little pessary that you pop inside.
Okay.
The information packet says, do not use if you have estrogen positive breast cancer because it's out of date. So ignore that. And you can get various creams, pessaries, and tablets. The trick with a tablet, if you're pushing it in, is you go in all the way to the hilt to the cervix and then come back a bit because you don't want the cervix to be moist. You actually want the vaginal walls. So just pull back a little bit when you pop it in. But it's brilliant. It's a game changer.
Yes, and I'm glad you cleared that up because somebody mentioned that you can't use estrogen creams. I haven't been told that. My oncologist said, no, you can, even if you have
Yeah.
estrogen positive breast cancer, which we both have had. And so I'm glad you cleared that up for us. So
what I've had in the UK is friends who've had it and their GP said ask the surgeon and the surgeon said ask the gynecologist and the gynecologist said ask the GP, and they're going around in circles because not everyone knows the evidence. But if we can put a link up on your website, then patients can print that off and say, look, it's safe. Can I have it? I accept the risk. This is my choice and my body.
I'll talk to
We
you about
have to
that.
fight our corner. Yeah.
Yes, I'll get the right link and we'll talk about that after we record here so I can get that information on
Yeah.
the channel. Yeah. Okay. What else?
There's another toy I wanted to talk about,
Mhm.
which again, someone phoned me up about my book. They're in the UK. I'm not sure they're in the States, but they're called O-nuts, as in donuts.
Okay.
And they are stretchy silicone rings that stack.
Mhm.
A single one can stretch really, really wide.
Mhm.
And what you can do, sorry, mum, you can put them onto a penis stacked. And what they do, so I'll just put the one is they limit the depth of penetration.
Ah.
So if I've got 3 or 4 there,
Mhm.
my husband could only penetrate the top 2 inches instead of the rest, because often it can be sore and painful, and that you're kind of tensing, that can stop the limit of penetration. But because they're silicone and they're tight, they still feel there inside you. Silicone, friendly with lubricants, washable. I'll have a look to see if they're available in the States, but something like that is also a really good thing. Again, just to make it, to help everybody stop worrying.
Yeah. You know what I can do? Usually, Liz, I take these videos and embed them into a blog. I think that's going to be a good
Brilliant.
place to list all of these
Yeah.
products. Or, you know, if you find them similar products over here in the US, because we have plenty of viewers that are going to be watching in the UK as well.
Yeah.
Yeah. Yeah. Okay.
I think I was just going to say the most important thing is to be really open and honest with your partner. And for me, a lot of women have said actually reading my book and getting them to read the book so they understand it's the breast cancer and the tablets that have made their partners not want to have sex. It's not their fault. And they understand what you're going through. And having that conversation not in the bedroom can really, really help. You just have to be open and honest and both be willing to work to have sex in a new way.
Yeah, and you know what a couple of women mentioned as they were having this discussion? A couple of them said, I don't think one, it was my impression they hadn't had their reconstruction yet. And they said, I keep my sexy bra on and I insisted it stay on. So that's kind of her safe place. It makes her feel comfortable and sexy. The other thing too, you know, when you go into the bedroom, if you're still feeling, you know, a bit uncomfortable with your scars and maybe you still are bald from chemotherapy, lower the lights. Lower the lights.
Exactly.
Let your partner know that. I think that sometimes people tend to be visual when it comes to sex, but say, hey, let's lower the lights now. I need to try this now, you know, to make it comfortable.
Definitely.
So, yeah.
And it's got to be on your terms. You have to feel comfortable. And I think exactly lowering the lights or just lighting a small candle, asking them to say, almost ground rules. I know you want to touch me, but can you not touch my tummy scar because I'm still a bit sensitive? So they know what you're not happy with. And then maybe outside, just giving you a massage with no sexual connotations behind it, where they may start to touch the scars and you can just relax and think, oh, okay, they can help you maybe accept that as part of you. But in the beginning, I think if you can lay ground rules before you get into the bedroom, and as you said, music, dark lights, other things to stimulate the senses, it's really, really hard.
Yeah, it is. I like your idea of talking about it outside of the bedroom.
Yeah.
I also like your idea, Liz, of handing them your book or any book that feels right.
Yeah.
And have them read it on their time and their terms.
Yeah.
Let them absorb it. Don't sit in the same room and say, let's have book club today.
Exactly. And you're looking at, well, what did you think? It's just,
Yeah.
some men don't believe what you're saying because they may find, look, I still find you attractive. Don't be silly. Come on, it'll be fine. And they don't get it. And it's even just a leaflet from a cancer charity so they can understand this is something permanent that has changed to you to keep you alive after having had breast cancer. And your libido may never come back. You may never get naturally wet again. It was going to happen when you were 60 or 70, not maybe when you're 30 or 40. So you'd have been using all these toys at some point.
Exactly.
I think, again, it's setting the ground rules and saying, well, this is, and also maybe having a safe word. If it does get sore because you're not quite relaxed enough, you need to know that you can say, stop, this is too much for me. Because feeling like you need to carry on can be very, very hard. I mean, I've had women say it almost felt like marital rape because they didn't want to stop, which just broke my heart. And again, these safe words to say, if it's too much, I have to be able to tell you to stop. And I'll finish you off if you want, or we'll just leave it. But this is going to take time. It's not going to be perfect. Like back when you're fumbling around as a teenager again.
Yeah, exactly. You know, I think some of the problem, this is a bigger issue you and I can't solve today, but someone brought up the fact too that there's such sexualization with breasts and with
Yeah. Oh, I hate it.
body. Yeah, that's what this one woman said. She said it just infuriates me and makes me so angry because once you find a partner that you want to have sex with, it's way beyond that. It's way beyond that. It's an intimacy and sharing, and you should be able to, or the hope is, even with all the difficulty, be able to use the tips that you talked about. It's not going to be easy.
No, and I think it's remembering that most of us fell in love with someone before we saw them fully naked. You're attracted to someone before you see them naked, and what they look like when you first started dating at 20 is not what they're going to look like when they're 60 or 70. You've had breast cancer, but your husband or your partner or your wife, you know, they may put on weight or lose their hair, or we all age and change, and this is just a part of that. And it's maybe you remind your partners that they don't look like they did when they're 20, but it's not about the body. So this is what I found hard. I lost my hair, I lost my breast, I had my ovaries removed, I lost my estrogen. What makes me a woman? Because I'd lost all the things you would give to a man who was transitioning. Mm-hmm. And I found it really hard to still feel I didn't want to wear sexy clothes. I'm flat, I'm lopsided, I couldn't wear a pretty bra. I just felt androgynous. And I realized it's all behind the eyes. My soul is behind the eyes. I'm still me, and I don't need hair, and I don't need my boobs again to make me feel like me. And that took 5 years to get to that stage. And I think time is a great healer to remind you that your breasts don't define you. You need to realize that you are so much more than that, and you will come to learn to like and hopefully love yourself again.
That is, oh my gosh, Liz, that's a good note to end on. That really is. Thank you so much for all this information today and for talking about this topic. I mean, I had so many women on this channel, and you know what? I want to add something because this just about this. I have women and men on my Facebook page, men that have breast cancer, men that are taking tamoxifen. I have talked to men who go through the same thing when they take tamoxifen.
They do.
And so I really hope that this conversation opens up with a lot of women and men who have been affected by breast cancer. I have one last question. Oh, I'm probably going to think of 15 more, but I thought of another one, and this has to do with the fact, Liz, that you are a surgeon and that you can address this. So whether you're your oncologist, your breast surgeon, your plastic surgeon, or even your GP, how would you recommend women bring this up? Because in fairness to the medical community, they have their niches. They have items they need to talk about with their patients. They're not the gurus of everything, but sex is a natural part of our physical being.
It is.
How do they bring it up?
So I used to think I was doing a good quality job when I had pretty scars, women flashing me in the supermarkets and no complications. But the third part of quality of care is the patient experience. I never talked about sex. I assumed someone else was, but I never checked. I think at diagnosis, it's really hard. I think when you go back to get your results and you start on the tablets, ideally you should be given a leaflet by the breast care nurse to say, these are some of the side effects. And I would love it if when every woman was diagnosed with, or man, an estrogen positive hormone blocker, they were given prescriptions or advice on lubricants and the drugs you can take to help with the hot flushes, and told, do you know you can buy this kind of stuff to help your sex life from day one? You might need this. Here is a book that will talk about it. Just that pack went out automatically. I'd love that. When I went back between my two diagnoses, I started doing it at the year one follow-up. And I would say, right, I know a lot of women have trouble with their sex life because of tamoxifen. If this is something you'd like to talk about, I can help you. And it was embarrassing at first because women were there with their partners, but the look on their faces of, because by saying it's normal for women to have this, if you do, I can help, they know they're not alone. So I can talk now, or we can come back later, or I can give you, but that was my way of saying it. Most women have this problem. If you do, I can help. Rather than a patient thinking, oh God, because we're so busy as doctors, there's so much to say. And rarely the mind, the exercise, the how you're doing, we don't really care about. That's all the GP and the nurses. I just want you in and out of there quickly. But if you were to say, I know this can be an issue. Do you want to talk about it? I think that's a really nice way of opening it up. And if you as a doctor or healthcare provider are not comfortable doing it, make sure someone in your team is, who you can then refer them to.
I love it.
Because it's everybody's right. And as a patient, it's really hard to go in front. You've waited an hour and you know there's a room full of people outside and you're looking at your watch and I was going to talk, but I won't. It's really, really hard.
That's a good way of putting it, because if they at least ask the question and have some resources.
And if you as a patient have got tips, you could tell your own breast care nurse, no one talked to me about sex, but this is what I found out. Can I share this with you to share with everybody else?
Excellent idea.
Empower your team to let them know what they don't know. Because I knew none of this as a surgeon. I was blissfully unaware.
Yeah. It's a team effort.
It is. And I think patients are the biggest driver of change. We have the chance to empower other patients to help doctors realize, because doctors don't like listening to patients because I think we're annoying and we know too much. And I only get listened to because I'm a doctor and a patient, which drives me mad. But actually, if every patient said, right, I've heard all this stuff about sex, you didn't tell me, but you can tell everyone else all across the States, we might change this for the good.
Yeah. Let's keep working on it.
Yeah.
Okay. Thanks so much for joining us today.
No, you're welcome, Terry.
Yeah, it's great seeing you. Stay safe. And if anyone
I wanted to say before you go, this is funny.
Yeah.
I couldn't work out why you were called DEP-C, because in the UK we pronounce deep as DEP, but why is DEP-C? And deep sea, I get it now.
First initial of my last name.
But the deep and DEP.
Oh, yes.
We call it DEP, and I thought DEP-C, that's, but you say it deep, so sorry, so surgical aside there, but.
No, I love it that you brought that up, because not everybody knows that. And the big joke is when I was trying to come up with a name for my platform so I could start educating about this.
Yeah.
And when I told my husband, I go, deep sea, I can use the first initial of my last name. He told me, he says, everybody's going to be looking for boats. Well,
You was wrong.
Yeah. Oh, well. That's an even better note to end on. Hey, if anybody has any questions or comments, or you have other topics you would like us to cover, please let us know. Again, Liz, thank you so much for joining us today.
You're welcome. It was fantastic to chat, Terry.
Yeah.